Hello and good evening, everyone. I welcome you to this medical webinar, Pathways to Primary Care Exploring Career Opportunities in Family Medicine. We have with us Dr. Kritika Ganesh, and I'm very happy to introduce Dr. Kritika Ganesh to our scholars. And before we do that, thank you, Dr. Kritika, for joining us. I know you're very busy, and in spite of your busy schedule, you've taken time to take this session for our FFE scholars. We're grateful and very thankful on behalf of FFE for doing this for us. And I would now like to invite Bhanupriya from the FFE team to introduce the speaker.
Hello, Dr. Kritika. Hi, everybody. Good evening, scholars. Hi, I'm Bhanupriya, and good afternoon, everyone. I hope you're all doing well today. It's my pleasure to introduce our esteemed speaker for today's webinar on pathways to primary care, exploring career opportunities in family medicine. We are honored to have with us Dr. Kritika Ganesh, a renowned consultant physician with a wealth of experience in the field of family medicine. Dr. Kritika is the founder and practicing physician at the Pocket Family Doctor Clinic located at Banegutta Road, Bangalore. Dr. Kritika completed her MBBS from JSS Medical College, Mysore, and further specialized in DNB Family Medicine at St. Philomena's Hospital, Bangalore. She is also certified in diabetes and hypertension management from the Public Health Foundation of India, which showcases her deep commitment to managing chronic diseases. Over 8 years of experience in family medicine, Dr. Kritika not only excels in patient care but also passionate about teaching and academics. She has contributed significantly as an adjunct faculty at St. John's Medical College, where she helped to create course material for distance education and fellowship programs. Her dedication to teaching is evident in her role as an executive committee member of the Academy of Family Physicians of India, where she actively participates in various academic initiatives. Her areas of interest includes women health, diabetes, preventive health, and patient education, which is she regularly shares her experience on social media pages at the Pocket Family Doctor on Facebook and Instagram, aim to bridge the gap between patients and physicians. Today, she will be sharing her valuable insights into the career opportunities in family medicine, a field that plays a crucial role in primary care. Without further delay, please join me in welcoming Dr. Kritika Ganesh to the session. Over to you, Kritika.
Thank you, Bhanupriya and Jennifer. Thank you so much for giving me this opportunity. It's so nice to interact with students who are, the future of healthcare in our country. So now, can I share the slides?
Yeah.
Yeah, one second.
Yes, I'll stop sharing.
Okay.
Hope you're having access to share the screen.
Yes. Is it visible?
Can you please
Yes.
make it full screen on a power slide? Yeah, then.
Yeah.
Yes,
Is it
perfect.
visible? Yeah. Okay. So good afternoon, everyone. So first, before I start, I wanted to be interactive. So if you guys can also, unmute and answer questions in the middle, that would be great. So before I start, I want to ask you all, how many of you have heard about family medicine, the term or the concept of family medicine? How many of you have heard about it until now? Or if you want, you can type it out in the chat box, I guess. Yes, Atikush Zilani has raised his hand. So, yes, okay. There are some people who have heard. There is somebody who has this course in their medical college. That's great. That's great. Yeah, some people have heard the term, but they're not very sure about what exactly it is. Okay, so I'm happy that there are people who've heard the term at least. So let me start off with my own journey, how exactly I got into this field. So I was like you all, completed my MBBS in 2011. And after that, I was pretty lost because, it's that time of answering the PG entrance, competing in these competitive exams. You're very confused about what you're really interested in, right? I was also in the same boat. One thing I was clear of was I did not want a surgical field. I wanted to do only medical field, like either pediatrics or general medicine. But that's what I was thinking of. So I tried, I dropped a year like how everybody, most of the people in India are doing. So I also did that, went for the coaching class and everything and answered the exam by the end of that year. And my rank was not very great that I could get general medicine or a pediatric seat. The cutoffs were pretty high that year. So I was quite disheartened. And I was also a little bit sad that I may have to repeat another year, which I did not want to do at all, because that 1 year was quite stressful. So I was thinking what to do when the hospital that I visit with my grandparents, which is in Bangalore, which is Philomena's hospital, I met one of the postgraduate students there who happened to be a family medicine postgraduate student. She was studying there. So by chance, I had taken my grandparents there for something else to meet some other doctor, and I'm happy to run into her. And that is when she asked me, and I was telling her that, I'm very confused. I don't know what to do and all that. And she was telling me that if you are actually interested in a medical field, why don't you consider family medicine? So that is the first time that I actually heard about that, which is not good because, we should have been exposed to it in MBBS itself, but we were not. But luckily, this is what happened. So then I went and did more research about it, tried to understand what is family medicine. I spoke to the other PG students. I also went and met the the head of department there at Philomena's. I went and met her, and then once I understood more about it, I felt it is a perfect fit for me because it involves a little bit of pediatrics, a little bit of adult medicine, and it's also I can also get to do some procedures, etc. I will come into it as I go through the presentation. But when I actually looked at it, it was a very good fit for me. So that is how I got into family medicine. Initially, yes, I was also unsure. But once I have completed and I've come out and I've been working for the last few years, I am happy that I chose this because I think it fits in perfectly with my priorities. So with that, let me just start off. So first of all, what we'll be doing in today's presentation is a little briefly, I will be telling you about what exactly is family medicine. We will be looking at how are the different ways in which you can this branch after your MBBS, and exactly what are the career opportunities that could be there once you've completed. Also, we will look at some common myths that are there about this. And finally, you can ask me your questions. So first of all, family medicine is basically somewhat an extended version or a more intense or specialized version of your MBBS training itself. That is what I would say. Like your final year, suppose you take your final year and do the same final year and internship for say another 3 years, that would be family medicine actually for all practical purposes. So basically at the end of that specialization, what is it that you will be able to do? You will be able to provide a comprehensive and continuous care to patients of all ages, from a newborn to a very senior person, like an elderly person, even end of life care as well. You will be able to address most of their common physical ailments and also a little bit of mental health because you have exposure to psychiatry as well, a little bit during your residency. And you will be most likely, ideally, you will be trained to practice within the community where you can, not hospital based, you will be more, comfortable and more trained to treat patients within the community itself, like, like a small clinic or hospices, health centers. In those kind of places would be your ideal place to practice. Of course, in the cities, you can also choose to attach yourself to hospitals where you have like a preventive health check departments, you have certain outpatient departments and all that. So there as well, you will be able to practice. So that is what your training will be catered towards. Throughout this 3 years, you will be exposed to quite a bit of general medicine, that is mostly adult medicine, a little bit of pediatrics, a little bit of gynecology, where you will be equipped to handle antenatal cases and basic gynecology OPD cases. Not the surgical aspect, but definitely the medical and treatment aspects of the gynecology and OPG part. And a little bit shorter postings, you will have rotations in departments like ENT, ophthalmology, psychiatry, like I mentioned, emergency department, ICU. And also there are some electives as well where some people choose to do anesthesia, where, people who are more interested in intensive care and emergency medicine, they might choose to add on a anesthesia postings as well for their in their course. You can also choose topics like dermatology. Like, for example, I think ophthalmology and dermatology are exchangeable. You can choose either one of it. And you will also have a short stint posting in a public health area, like either an urban health center or a primary health center, where you will look at the government-based schemes. You will understand that population and how to manage those population of patients. So this is all what is family medicine essentially. Okay. So what do exactly family physicians do? They can handle a wide range of medical conditions, from all even common illnesses like your cough, cold, whatever, to ultimately chronic diseases. So you are the primary health point for all your patients. So somebody is sick, the entire family is sick, anyone in the family is sick, they will come to you first. This, I think, if some of you remember, it would be similar to the situation which was there many years ago. Like, we used to, every house will have a family doctor whom they will consult for everything, right? I had something like this when I was a child, where we used to have a old doctor who would sit in a small clinic in Chennai where I used to visit him. For any problem for anybody in the family, we would always go to him first, and only if he instructs, we will further go to the other specialist. So that is how that concept basically. So you will be the primary point of contact for most of your patients. This helps ultimately to build a long-term relationship. So you will be seeing the same family again and again. So when you meet them often, like you will be treating the grandfather for maybe diabetes, the child will come to you if they fall sick for their vaccinations. You will be handling the mother's complaints if she's having any menstrual problems. Like this, you will be handling the entire family, and you will get an opportunity to develop a long-term relationship over them for few years. In fact, it is quite enriching, and I would say quite rewarding when this happens over time, because then they start taking your advice even for non-medical things. And it's nice, when they invite you to their family function, or they include you in their happenings within their families, right? So it's quite enriching that way. Also, there is quite a bit of emphasis on preventive care. Like what I have noticed mostly, and you might have noticed this also, is a lot of times when patients come to the OPD, especially in your medical colleges and all, if you've sat in the OPD with your senior doctors, you will see that they would have come there with a problem. So you're trained to first ask them, so what is your problem? And then they will start, right? Even our history is, the history taking in MBBS is catered like the chief complaints. The patient is always having complaints first, right? So that's how we start. But family medicine is a little more different, where they also come to you for preventive health. Like they might come to you for routine health checkups. They might come to you with a newborn which is born like 6 weeks postpartum. The mother might come to you with the baby and herself. Or you could also have older children coming to you for vaccinations. So where you have an opportunity to give them health education, to give them advice about what to do right, what to do wrong, that kind of. So there is an emphasis not only that you're guiding them when they are sick, but you're also guiding them to continue remaining healthy, even though they are not sick at that moment, right? Another very important aspect of what I do is to coordinate care with other specialists. So if suppose I have a patient who, like, for example, has come to me with just a fever and some cough maybe, and then I do her basic investigations and I start her on some basic medicines, and then again, once the investigations come, I have a doubt that maybe it could be tuberculosis. I kind of get an x-ray, I do all the basic a part of her care. And at a point when I feel that no, this is the point where I need to involve a pulmonologist or some other specialist, that is when I refer to a specialist at that point, and I act as a liaison between the specialist and the patient, where I can, since they have more access to me, so they will be able to get my appointments easier than they would with a specialist. So maybe they might visit the specialist and they might want to come back to me for follow-ups, or I will be able to interpret what the specialist is having a plan for them better, and guide them in that journey of whatever is their health problem, until they need to take the opinion of the specialist. So that is something which is very common, which we do, and which is very important actually. Instead of patients directly going to multiple specialists and getting confused, and each specialist looking at only their aspect, the cardiologist, if the patient goes to the cardiologist may see his problems. But after that, if the patient says, doctor, I'm having some itching in my head, or if I'm having some pimple here, the cardiologist will say, please meet a dermatologist, right? And the patient will have to go there. And then, so this kind of cycle is broken when you have a primary care physician involved. So we will be able to treat them for all the basic conditions and only refer if required, thereby cutting down healthcare costs a lot and preventing unnecessary frustration and roaming around for the patient in the among the other specialists. Also, what I feel is primary care doctors or family physicians, we are trained to be versatile, because throughout our training, we are exposed to different scenarios. Like I said, different departments, different setups, like OPD, inpatient, OT. We also, go to the primary health center, right? We are exposed to different kind of environments throughout our training. So that automatically makes us adaptable. So I will be, so a primary care physician can work in her own clinic in say, urban center, but at the same time, she might be able to work in a primary health center in a rural area, right? So that's how the training is, designed, so that you can adapt to different circumstances. That is another thing which is a big, a positive which I see in my job, compared to a lot of my hospital-based colleagues who are very much dependent on the hospital setups. So you have these neurosurgeons or, some other, specialties where they are very much dependent on the hospital to for their patient practice. So for us, it is not like that. For me, it is more, adaptable, where I can choose and I have the freedom to choose the kind of practice that I want to have. So that is another point that is there for family physicians. So this concept of family medicine has been there for quite a few years now. In fact, in the countries abroad, especially countries like the US, UK, Australia, Canada, etc., where there is even the whole of Europe, right, where there's a lot of either like for USA and all, you have a lot of medical insurance based practice. Whereas in UK, Europe, Canada, you have government health, which is there, where it's healthcare is mostly free for all the citizens, but the government bears the costs, right? In all those kind of setup, they have already understood the importance of family medicine. So they have what are called as GPs, like in US, in UK, Europe and all, it is called GPs, okay, general practitioners, GPs, or in Australia, Canada, USA, they are called as PCPs, or primary care physicians. So every family, every patient is assigned in every county, is assigned to a primary care doctor in that region, in that area. In fact, so much so that if you ask any of your friends or any of your relatives who might be abroad, they will give you a better idea about how you need to actually be in a wait list, because the number of doctors to patients is very less over there. So in UK and all, you have to put your name on the wait list for a particular primary care doctor and wait until they accept you as their patient. So every family is mapped to a primary care physician in that particular area. So for all your basic health needs, you will be visiting that doctor. And only if that doctor gives you a referral letter will you be going to a specialist. So this concept is already very well established in a lot of the countries abroad. In fact, even in some of the South Asian countries like your Sri Lanka, Nepal, Pakistan, you also have Malaysia, and certain countries in the Philippines. These countries also, family medicine departments are there in the undergraduate level itself. Of course, in India also now slowly the departments are coming up. But this concept has been very well established even in these other countries, which are actually not as developed as India itself. Even then, they have understood the importance of primary care. So now that you have understood what exactly is family medicine, let us understand how we can become a family physician. Like, how can you specialize in family medicine? Okay. So firstly, you have the traditional MD and DNB courses. So of course, the entrance through this is just like any other specialty where you do it through your NEET PG. It is rank based. It is a 3-year course usually offered at certain medical colleges. Like earlier, only 1 or 2 medical colleges were offering, but in the last 5 years, there has been a significant strides which have happened. Especially post-COVID, I think people have really realized the importance of the community physicians, and even the government has allocated funds for it, and they have made pathways for medical colleges to apply for this field. So all the newly opened AIMS have family medicine departments. We have colleges like St. John's, CMC Vellore. You have Calicut Medical College, and there is 1 or 2 other medical colleges in Kerala who have also started the family medicine departments. So this is the traditional, medical college MD degree, which is a 3-year degree with your regular theory, practical exam, thesis, etc. You also have DNB courses, which of course right now are also the entrances through NEET exam itself, as I understand. So these DNB courses are offered across India in multiple private hospitals, tertiary private hospitals. You have a wide range of hospitals, a lot of mission hospitals, charitable hospitals, lot of big corporates like your Fortis, Apollo, those hospitals are also offering the DNB family medicine seats. So nearly, I think, as I understand, there are nearly 220 seats in the last exam, I think, the DNB seats itself across the country. Again, so this is your traditional route through your NEET PG, and it is rank based. Then you have another course called the Diploma in Family Medicine, which has been introduced by the National Board recently. So this has been started only, I think, 2 to 3 years back. But these courses are having a lot of takers. It's only a 2-year course. It's a diploma course. It is offered at taluk and district level hospitals, government hospitals, and certain other smaller hospitals, which are attached to bigger medical colleges as well. So this is there all over India again. This again, the entrance is through NEET PG, but the ranking is the cutoffs are much lower because, of course, since it is a 2-year degree and it's a diploma course. Just like similar to your other diploma courses, right? Like your DGO, Diploma in Ophthalmology, DCH for child health, all these kind of similar to that. This is also a diploma degree for 2 years, where you don't have any thesis, you have theory and practical exam like usual. Then you have another thing which you can explore are the distance education fellowships. Now, even though distance education sounds like, it's not really, oh my God, how will I learn in distance education? It's not like that, because family medicine, you already have a basis for for it through your MBBS and your internship. If you've done your internship well, you will already have a good sound knowledge base actually. You just have to build on it, right? So hospitals like CMC have very good programs. In fact, the CMC program is so good that I have so many, there are so many practitioners who have done that course who are independently practicing even in big cities and having very successful practices actually. So you have it is called the Postgraduate Diploma in Family Medicine, PGDFM. It is a 2-year course with contact program in the middle. I think 2 or 3 contact programs in the middle, and the rest of the course is very, to the point, very well designed course actually. And then you have the St. John's Medical College course, which is also the recently started course that is also around 3 to 4 years old. It is a FFM, that is Fellowship in Family Medicine course, which is only a 1-year course. That is, again, it will give you some idea. See, I would, a lot of that course, I was very much involved in making the course material for it. So, I'm biased in advocating it, but that is a great course for you to do during your internship itself, or just after internship if you're waiting to study your PG or something. It's a great course to do to understand what is family medicine and to get your creative juices flowing about, oh yes, I want to do this course. If you're in that boat, this is a great course to do. It's not very expensive, and it is a very well designed course. This also has a contact program. I think 2 contact programs once in 6 months. Then you also have another program called the AFPI, that is the Academy of Family Physicians of India Karuna Trust Fellowship. So this is in collaboration with this charitable organization called Karuna Trust, where they expose you to certain aspects of family medicine. It is also a great way to get yourself exposed. I wouldn't say that is equal to studying family medicine completely, but it's definitely a great way to understand the workings, especially if you're going to go abroad, if you're going to go for public health, if you're going to get into research. It's a great fellowship to do. And of course, you have the MedVarsity, which is another independent organization, which is also offering a 1-year fellowship of family medicine. That is again a distance education program. That is also quite a good course, as I have heard. And then, of course, you have the other pathway, which is the writing the MRCGP exam. So if you can, after MBBS itself, you are eligible for this program actually. You only need 3 years of working in a family medicine department. So you could associate yourself with or even a general medicine department will do. So you can associate yourself as a senior registrar or a junior registrar. You can work in any of these, hospitals which has a department, and then you can write the MRCGP exam, it is very similar to your MRCOG, MRCP exams, the Royal College exams, which is a 3-step exam. The first step has first 2 steps are theory based, and the third step is a practical OSCE based exam. So that is also quite popular. It is especially in the corporate hospitals and in the cities. That is also a recognized degree, where you do get, even though it is not an MCI recognized degree, the corporates do give value for this MRCGP completion, because it is prestigious in its own way. So these are all the ways in which you can get yourself equipped to specialize in family medicine. Now, after completing, most of the times what happens, since it is a very broad, it's a very wide field, right? So I'm exposed to so many things throughout my 3 years, but my interest could be something specific. Like, for example, for myself, I'm interested in diabetes. So I went ahead and did a certification with the Public Health Foundation. So you have other certifications also in diabetes, hypertension. You have this from CMC as well, and various other organizations. Even this MedVarsity offers certain. In fact, you also have distance education programs from abroad as well for diabetes. So you can do something like that and then focus your practice towards that. Even though you are still a general practitioner, you're still a family medicine specialist who sees people of all ages, you can choose to do it out of your own interest and have your own more patients of that particular field of, say, diabetes, or even geriatrics is there. You can do a PG diploma in maternal and child health, which is offered by IGNO or the Indira Gandhi University. So all this will enhance your particular talent in that field after your completion of family medicine. So that is a great way for you to focus on that particular field if you have that interest. Yeah, so you also have the primary mental health course from NIMHANS. You have ICU emergency medicine certifications fellowships offered by various universities. You have hematology certification courses. And of course, you can also get into management, because if that is your interest, you can also go on to do like an MBA or something, because your basis, your roots of family medicine which you have will actually help you there also, because there is some leadership skills, there is some understanding of how the whole hospital works actually when you go through your training. So some of my colleagues actually have also shifted into management side as well after doing the MBA. So this is what you can do after family medicine. And then, of course, coming to the career scope, what I'm doing is I'm having an independent practice. I invested some money, set up my own center, and I'm running it as a complete health center where I have like an OPD setup. I have a small procedure room where I do small procedures. That's another thing. You do have exposure to general surgery as well. So I do suturings, I do incision drainages, I do dressings, diabetic foot care management, some gynecological procedures like pap smears, endometrial biopsies. So all these I do in the clinic by myself completely. So this, along with some lab association if you can have, and I also have a daycare center, so I can have patients for IVs or for short admissions for a day or so. So this is also there in my clinic. So this is my idea of having a community healthcare setup, which I have done. This is not very difficult. It might look like, oh my God, you have to invest a lot of money. It doesn't really, because you don't need fancy equipments to practice family medicine. You just need basic things. And you will, if you are good at what you do, and if you choose an area where there is a need for this service, 100% you will do well over a period of time. It takes some time, but you will do well. So this is something, if you are looking into, if you're from a especially in the tier 2 cities, in the suburban areas, this is a great way to have your own independent practice. That way it will give you flexibility, and it will give you that respect and the satisfaction in the community. Another way of going is to enter into public health. So you have railway medical officers, you have army medical officers, you have a lot of state health officers. Now all these positions open up for you after your family medicine degree. If you have done MCI recognized courses like DNB, MD, family medicine, your pay grade will be the same as a general medicine person in the public health sphere. If you are doing only certifications, then the pay grade might be lower, but there is still a lot of scope for growing in the public health sector as well. So if you are somebody who is interested in to get into the public health aspect, there is a lot scope, in fact. Of course, nowadays in the urban setups, you have a lot of corporates, you have chains of clinics. Like in Bangalore, we have this chain of clinics called the Family Doctor Clinic, right? And you have a lot of chains like this which are employing family doctors. You have health checkup departments in all the big corporates like your Fortises, your Apollos, your Manipal, and all these big names, bigger hospitals, Max Hospital in Delhi, all these kind of bigger corporate hospitals all have a health checkup department, a travel health department, and preventive health checkups and all that. So they are employing family doctors because they have understood that we are able to cater to all populations. We can look at women also, children also, that is very useful for them. Instead of having a separate general medicine doctor and a separate pediatrician in the department, they might as well have one single family medicine specialist. So you also have a lot of telemedicine startups. So one of the startups that I was working with till recently was this organization called SugarFit. So they manage diabetes patients online. So I used to do online consultations for them. And they also were very happy to have family doctors because we are again able to cater to a wide range of population. So that is another thing which is which are beginning to employ family doctors these days. You of course have insurance companies, insurance medical officers. Of course, even as just as MBBS doctors also you have openings there. But with a family medicine degree, again your CV gets enhanced, so you have better opportunities. Then, of course, you have hospitals, smaller hospitals, nursing homes, especially in rural areas and tier 2 cities. You will be a great asset for them because you can do the primary management of most of their cases. And considering our initial training is in the hospital setup, we can actually deal with a lot of inpatients also, basic inpatient care as well. And we can be like a team member for the bigger consultants. So even if you have the big cardiologist or a big surgeon doing the procedure and everything, they do need somebody in their team or in the hospital who is responsible enough and knowledgeable enough to follow up their cases and to be there. So this is a great thing for especially in the smaller hospitals where they do need somebody who has like a jack of all kind of knowledge. You know a little bit of everything that you're able to handle basic. And then, of course, you have certain of my colleagues who have gone on to do a hospital-based practice also. Even though our basic training concentrates more on outpatient care, since our Indian health setup, a lot of the MD DNB courses basically hospital-based, we do have exposure to inpatient care as well. So if that is your interest, if that's your calling, you can have a hospital-based practice also. You can also get into intensive care. You can get into emergency departments where you work in a shift. That if that is your interest, then that is also a great thing that you can do with this degree. So so this is it would be your career scope overall. Come to a small myth which I feel many people have is that many people think that family medicine is the same as community medicine. Or they also are confused what is the difference between general or internal medicine and family medicine. So this is what it is. I just wanted to put it out here. So as a family medicine specialist, you see all adults. You can do basic antenatal care. You can do basic pediatrics and basic gynecology. As a community medicine specialist, I mean, if you specialize or if you do your PG in community medicine, mostly in most of the medical colleges, it is a public health based education. You're not doing clinical practice there, except I think in CMC Vellore and maybe PGI, or I don't know, one of the other, I think JIPMER or one of the other hospitals, only there the community medicine department does clinical, they see the patients clinically. Whereas everywhere else, it is mostly concentrating on research, on surveys, on, basically public health. General medicine or internal medicine, on the other hand, they basically are working within the hospital setup, first of all. They admit patients and they're more better at, trained for, rather, in internal, hospital-based inpatient care. But they do have their own clinics. They do see outpatients as well, but they only see adult patients. They don't see women. They don't see gynecological complaints, and they definitely don't see children. In fact, anybody who is lesser than 14 years, they will just send them to the next OPD, which is the pediatrics OPD. As family medicine, like I said, it's a mainly OPD practice, and this is hospital based, whereas your community medicine is community interventions, etc. And then family medicine, one disadvantage is after you finish your MD or DNB, you're not eligible to do a DM. Whereas in general medicine, they can go ahead and do their cardiology, gastroenterology, etc., etc. They can super specialize. Whereas family medicine is a broad field where you don't get the traditional DM super specialization pathway. Whereas you can get your certifications, fellowships if you have any particular interests, and you can practice along with your general family medicine practice. You can do that as well. So I think this is the common myth that I've seen, which I hope I've clarified with this. Yeah, so I think that's overall, I think I've covered what I wanted to say. We can like have the Q&A after this, or any doubts, anything, I'll be happy to answer.
Hi, Dr. Kritika. Thank you so much. Thank you for this excellent session. And we have a few questions coming up now. So I hope we can take it one by one. So the first question is, what are the different career opportunities after MBBS?
After MBBS.
Yeah.
Yeah, okay. See, that's another thing. You can practice as a GP in the community setup just after MBBS itself, provided you have you have done your internship well and you have some knowledge. You can do certifications, like I said, most of the certifications which I mentioned, right? Like your the PGD, the P postgraduate diploma in maternal and child health offered by IGNOU. You have your geriatric fellowships. You have certifications in diabetes, hypertension. All these, you are eligible to do them after MBBS itself. So you can do all these certifications, enhance your knowledge, maybe work under a senior physician for some time, and then practice as a general practitioner. Even if you don't want to do a PG, a traditional PG also, it's okay. You can work like that also as a general practitioner. It is possible.
Great. Thank you, Doctor. Our next question is, which is better, PLAB or USMLE?
Lab.
PLAB or US? Yeah.
USMLE. Lab is if you have to go to UK, right? And USMLE is if you have to go to the US. So, I mean, it depends on you. Where do you want to go? Which university you are applying to? The individual, cost of living in these two countries. I think based on that is what you have to decide, which exam among these two that you have to take. I don't think they can be compared.
Sure. So the next question is between specializations, pediatrics and radiology, which has a better scope?
I think it depends on your interest. If you are interested in taking care of children and that's what gives you joy, you should have pediatrics as your aim. If you don't want to see patients, you want to sit behind a screen and look at the radiology things, then you should go for radiology. It's not like that. There's enough money everywhere. It's not, don't think about your life only in terms of scope. Look at what you want to do, what's going to give you joy for the next 30-40 years of your life. You're going to be doing this, right?
So students want to know what is the difference between DNB and MD?
So as of today, DNB and MD are equivalent. The only difference is MD is the degree is given by your particular university what you're studying in. Like for example, you have the Rajiv Gandhi University, or you have the individual medical colleges like your Manipal University or whatever. Whereas DNB across India, in whichever hospital you do, the degree is given by the National Board of Exam, NBE, in Delhi. So that is the only difference. Another thing is the place where you do, no, in your MD is usually in a medical college, whereas your DNB is in a private hospitals, tertiary care hospitals. There could be different types of hospitals which offer it. So again, that is something where if you have like a very corporate hospital, they may not give you enough chances. Whereas in a medical college, the chances may be better to get, that kind of difference. But the degree as such, once you get the degree and get out of it with the degree, they are equivalent. Because you would have done 3 years, you would have studied for 3 years, you would have written a thesis, and you would have answered the same practical and theory exam as your MD students do. So yeah.
Thank you, Doctor. Our next question is, can one join as IAF doctor and then prepare for UPSC? Do you have knowledge about how to become one specifically in IAF?
IAF is, you mean Air Force?
Yeah, Indian Air Force.
Yeah, I think they have their own separate exam to enter into the Air Force. where yeah, and there are people who join work there and then study and prepare for their other exams. It does happen, but I think you have a certain clause where they can post you wherever they want, and you have to work for minimum 5 years or something like that. There is a clause which is there. So if you're okay with that, Air Force is a great place to work because they give you, you get pension, you get like your entire, you get a lot of benefits, plus you get a good, colonel or captain, or have those kind of prefixes which really help as well. Yeah.
Thank you, Doctor. Our next question is from Gandharv. How do we ensure that after doing family medicine, we can secure ourselves in clinical practices, because most of the people try to reach MD medicine or a physician for their illness? Okay, they reach out to a yeah.
That is not true. People want somebody who can treat their illnesses. Okay. They don't care whether you have done general medicine, family medicine, they don't care. As long as you're a physician who's practicing your clinical medicine and you're able to handle their illnesses and you're able to talk to them and get them out of their problem, and you're doing right by them, patients will come to you. So this is a myth that patients are going to look at only, some super specialization or something like that. That's not like that. I have been practicing by myself without any general medicine or any degree, and I've been pretty successful. I see nearly 250, 300 patients per month. So it's not at all like that. This is something which is a myth which people, I don't know why it comes up after MBBS, where, everybody wants to do only particular courses because they are thought to be superior to others. It's not like that. It is a very much a clinical field. So compared to a non-clinical field, maybe I can agree, but as a clinical field, it has very good scope. There is no doubt at all.
Thank you, Doctor. Our next question is about AI. Would there be any effects on jobs in radiology because of AI?
Radiology, maybe. Yeah. I'm not a radiologist, so I may not be able to comment on that.
Okay. So students want to know about research after MBBS. How is it a good career to be pursued, and how do we go about it?
I think research opportunities are there with fields like paraclinical fields, mostly like your pathology, microbiology, etc. With clinical fields also, there is research scope. Of course, it depends on the organization that you're working with, having a mentor to do it. And there are a lot of clinical research organizations which employ doctors as well. So that is something you can look into if you're interested in research.
Okay. So we have a very sensitive question from one of our scholars. So I'm a second year scholar and I'm into my clinical postings. So when I go there, I don't feel confident and comfortable when I see the people's pain and dying. Once I even fainted when a person died in the ward while I was taking history from his attendants. Okay, attenders. From that day, I feel so depressed and confidentless, and also feeling that I'm not fit for this profession. How do I really overcome this?
I think this is just because you're still in second year. It happens. Like I remember even in first year when I saw a dead body for the first time, even I fainted. So it's part of growing up, because as you complete your MBBS, you're also growing up, right? You're becoming more mature in your thinking and understanding of the world around you. So that along with generally being in the hospital more, seeing more patients, becoming better and better in your communication skills over a period of time, you will get over this. As long as you're interested in the subject, as long as you're interested in making a difference in people's lives, that is more than enough for you to be a doctor. Those thoughts are more important. These things you will learn to slowly handle it over time. So I don't think it's such a big deal that you need to be so demotivated about it. Just give it some time. You're still in second year, so by the time you reach your final year, you do your internship, you will automatically figure out ways to get over these things.
Thank you, doctor. So we have a couple of students asking one common question, whether they choose between surgery or general medicine, because their seniors have been told that a surgeon is a complete doctor, but the people are more inclined to MD medicine. Which one is better?
See, there are two things that you need to consider. One is, of course, your interest. So, if you are interested in surgery, if you're interested in, you will get exposure to actual surgical procedures during your where you will maybe you will assist your PGs in the department in the OT. You will see them doing suturings in the emergency. You will see all that, and you will understand what really surgery is during your internship, or maybe a little bit in your final year as well. So when you see that, and if you feel that gives you joy, and you like it, that's a great thing to aim for. On the other hand, if you're somebody who's not interested, who's not good with surgical skills, who does not want to stand in the OT for hours together, and then you simply take up surgery just because somebody told you it has a good scope, I don't think it will be fulfilling enough for you. So first of all, look at your interest. If you're interested in both, like say there are some people who will be like, yeah, I like surgery. Oh, yeah, I like medicine as well. In that case, I would say you consider another thing, which is the time taken to become good at what you're doing. So as a surgeon, not just after you finish your MS general surgery, you will not be very confident. You will have to work under a senior surgeon. You will have to hone your skills. The surgical skills come with few years of learning it, because it's a craft. It's like skill, it takes that, that climbing up the ladder takes time, right? So whereas with general medicine, it is a little more easier. So when you consider all these points, plus when you, based on your rank and based on what you the seat that you get, you can take the decision of what is better. See, ultimately there is nothing which is like very much better, or there is scope in both. There are enough vacancies for doctors in both, actually. So look at your interest and look at the time taken to reach your the expertise. I would say that is how you decide. Yeah.
Hey, doctor. We have a question from Deepthi. What are the best books for CMFM?
CM
FM, I think community medicine, family medicine. That's what she meant.
medicine. Okay. So family medicine, you have there are certain family medicine books, but we studied basically each subject book separately. So I studied Harrison's, I studied, your Das for your, surgery, and I did exactly those separate books only. There is a manual of outpatient medical practice, Washington Manual of Outpatient Medical Practice, which is a very useful book, because it helps you aids you in seeing a variety of cases in the OPD. There's another book called the Oxford Manual of General Practice. This is also a very good book for specifically for family medicine as such. Yeah. But
Thank
of
you.
course, your basis in each subject is important. So each subject textbook you should be able to read.
Sure. The next question is from Sainath. So, as part of the clinical exposure, I have a doubt in the process of approach. Should we go by learning by symptoms and then about the disease, or learn all the system and then apply knowledge on the disease? Which is best?
Uh, I I think that depends on, at least in family medicine, we have a very symptomatic approach. That's how we are trained, actually. So we take when the patient comes, it's like approach to syncope, approach to fever, approach to say anemia, something like that. So, we take each individual symptom, what the patient comes, and then we try to understand what could be the final diagnosis. So, that's how I have been trained over the last few years. But again, it differs with different specialities and what kind of patients you're seeing. I don't think there's a set way for that.
So what is the difference between general medicine and internal medicine?
General medicine and internal medicine are the same. It's called internal medicine in the US. It is called general medicine in Europe and UK and all that. So both are actually the same. Primarily a hospital-based inpatient care of adult patients. That is what is both of them are. That is what it is.
Is super specialty very necessary for practice in tier 1 city?
I would say no, because I'm working in a tier 1 city. No, it depends on what you are interested in and what kind of a lifestyle you envision for yourself. If you, it's not that super specialists have it easy either. They all are struggling in their own way, being dependent on the hospitals to get in their patients, having much fewer patients to see compared to a generalist. So they have their own problems to deal with also. Again, there is no real one answer for this question. But my answer would be like, it is not a must. It's not that everybody cannot be a super specialist. It's not possible. So that's not true, actually.
So we have the last question for the evening. What would be the different legal aspects of your department? I'm not too sure what the students
Whatever rules apply for an MBBS doctor applies to you as well. I mean, just after your MBBS itself, you are whatever medico-legally you're inclined for, you will be anyway held responsible. The medical negligence or vicarious responsibility of what your staff does under you, all that, writing death certificates, giving occupation health certificates, everything, leave certificates, whatever it is, everything, whatever an MBBS person is accountable for, you are also accountable for the same things. The thing is, there is actually no real rule. There is, for example, there is one aspect which I wanted to highlight here. There is a common belief that deliveries and childbirth should only be done by a gynecologist. But that is actually, there is no legal rule like that, because in a lot of the rural areas, just MBBS graduates are only delivering babies in the primary health centers. So there is no, legally, there is no such rule actually. So as a family medicine practitioner, in fact, some of my seniors from Philomena's, they are working in primary health centers in some of the rural areas, in remote areas. They are managing antenatal cases completely, and normal deliveries also they are doing by themselves. So there is no legal limitations as such, I would say. Of course, if it is out of the scope of your thing, like some kind of cesarean or other surgical aspects, maybe which you're not trained in, yeah, maybe not. But everything else, from the medical point of view, there is no legal restrictions as such. Yeah.
So Surendra has asked a question. Is it necessary to be a urologist for doing kidney transplant surgeries?
Of course.
Yes, I think so. Yes. Yes. You probably have to specialize, train yourself in transplantation as well after urology.
Okay. So yeah, that sums up all the questions that students have asked, and we've almost come to the end of the session. So thank you, Dr. Kritika. I'm sure this session was extremely enlightening. It was a delight listening to you, and very interactive Q&A. So thanks to Dr. Aruna, who had arranged this for us. I mean, she's always there for FFE scholars, and especially FFE medical scholars. And I'm so excited to work with her, and she's as much as excited I am. She's excited too, and she brings in a lot of these topics which students find it difficult to fetch, and see it as a scope of employability in future. So, Dr. Aruna, would you like to say a few words?
Yeah. First of all, thank you so much. And I think, Kritika, you were amazing.
Thank you, ma'am.
Job. It was very important that I get you in this time, because if you realize at some of the questions that many people ask, when we're out of MBBS, we all have major dreams, huge dreams, that I'm going to be a cardiothoracic surgeon, or I want to do kidney transplant, as somebody mentioned, and so many other things. But let's remember that in India especially, numbers are huge. We have a huge number of students who pass out. The number of seats available for post-graduation, both DNB and MD included, or MS, are very, very few. So each year, the number of people who go in for PG are very few. The rest of us have to then need to do other things. So today I just wanted to highlight on one small thing, which I think every student who's doing MBBS should do is have a plan B in life. And plan B is, I think all of you know what's a plan B. You could put your, what is that, raise your a thumbs up or whatever to tell us if you know. Plan A is like, okay, like let me tell you my own case. I always wanted to work with children, and my plan A was to do an MD in pediatrics. This was what I wanted to do. And in those years, there was no DNB. There were no private colleges. So we had limited. There were like in my medical college, I passed out of Bombay, there were only 3 seats for pediatrics. Overall in Bombay, there were 5 seats. For how many students? About totally in the 4 medical colleges of Bombay, we were about 800 or 700 students passing out. In that, the number of medical MD seats were 5, and there was no other options available. Like Kritika mentioned, I did not get in those 5. My rank did not come in those first 5. So I had a plan B, and I was also interested in preventive medicine. So I did start doing postings in preventive medicine. But when I did my second house post in pediatrics, I just couldn't leave the department. So what did I do? I did, because in Bombay, we also had very highly recognized diploma courses. So I did my DCH through the College of Physicians and Surgeons in Bombay. And I completed my DCH and started doing pediatrics. So what I want every youngster to remember is that please have a plan B in life. Plan A is our dream. Plan B is what is actually probably more likely, which we will end up doing. Make this plan B as beautiful, as interesting, and as doable as it is possible. And when you do this, what happens when the results are out, or when the seats are declared? If you don't get a neurosurgical post graduation, but you have a plan B, which according to you is as interesting, you don't take it up as through a point of failure, but you take it up as a second option. And when one does that in life, you're going to give your whole heart, and you're going to put your heart and soul into it. So I think this is very important. We hear a lot of young MBBS doctors harming themselves these days. I'm sure all of you know it. We read about it in the papers every day. And I think most of the time this happens because people do not have a plan B in life. They're after one goal. And when they don't achieve that goal, they get totally depressed. So if you want to avoid all these issues in life, please have a plan B. Just to add another small thing, somebody had asked Kritika about AI and radiology. Am I right? Now, AI has come in, whether we like it or not. AI has come in. AI is going to replace a few jobs, but AI is creating new jobs. Remember, AI is a tool. It's going to be a very useful tool for every doctor to use. So let's not feel threatened by it. What you need to do, and you guys are very young, you need to understand how are you going to use AI in your practice. Start working on it from now. Get yourself completely computer literate to the extent that you will be able to use AI very successfully in your practice. And I think this is extremely important. Another thing is about legality. Legality, in my mind, if you document everything that you do, whether you're in an outpatient, in a clinic practice, or in a hospital, you should document everything very clearly with date and time. You are going to be very safe. Remember, the problems come when documentation is not there. And another thing is, everyone, once they're out into medical practice, please take indemnity insurance for you. When you're practicing or you're in a hospital, there is something called an insurance for your professional work. So one needs to take care of that. So if you do these things, have your degree properly, whatever your degree, an MBBS, a postgraduate degree, see that your degree is, you have the certificate, you display that, you do everything legal in the sense, don't compromise on getting medicines or vaccines which are cheaper or not the best ones. See that you use what is recommended by the academies. Don't go by just costing. Third, document everything. There is no reason for you to fear because you cannot work with fear. You cannot do medicine if you're going to be scared of everything. So just get bold, but be right. If you're right, usually things don't go wrong. So I think I just wanted to add this. I want every youngster to have a plan B. In fact, Jenny, you should ask them to start writing what their plan B is because it's important that everybody starts working on it. I think this is the way to go forward. And that's all. I just wanted to add these few things today. And thank you, Jenny, and thank you, Kritika, for this wonderful session.
Well, the pleasure is ours, Dr. Aruna and Dr.
Thank you,
Kritika.
ma'am.
FFE is grateful and honored to have you doctors, spend this Sunday afternoon for our FFE scholars. It's like I said again, it was a delight listening to both of you. And Dr. Aruna, your plan B, the plan B model. I'm sure after our third or fourth webinar for the next year, we'll have students coming up with plan B and they'll have something in mind. So
Yes.
this was such useful tips. So scholars, please make note of all the tips that has been given today and start working on it. I hope this session was as wonderful as what it was previously, our previous sessions. So thank you, Dr. Kritika. Thank you for your time. And thank you, Dr. Aruna. We'll see you in another enlightening session in future. Thank you all. Have a nice evening.
Thank you.